bit crazy. The receptionist isn't here today, so I'm gonna have to book you in myself, okay? Is that okay? Great. So, just going to... You have booked an appointment, yes? Yes, okay, great. I'm really sorry about this. Okay, just got to find the right date. Always helps. Okay, here we are. I'll just grab a pen. So, let's just get you in, okay? So, can you just confirm your name and address, please? Yeah. And your contact telephone number? That's great, okay. So you're in today. It says on here that you've been suffering from headaches. Right, okay. That's not a problem. Okay, thank you. So, I just want to introduce myself real quickly. My name is Dr. Smith. I am a fully registered doctor, and I am also a registered dentist, believe it or not. But doctor is my forte. So, now that's all cleared up. So, you're booked in today because you're getting lots of headaches. Could you be a little bit more specific? It's normally around the top of the head. Okay, okay. Right. And it's like a throbbing headache, like you can feel your heartbeat kind of thing. Okay, right. Okay, that's not a problem. No, not at all. That's fine. Okay, well, what I'm going to do now is I'm going to start off by having a little feel around your temples, make sure there's no swelling or anything like that, okay? So I'm just going to put on some gloves, and I also have to put on my hat as well, okay? Bear with me one moment. Seem to have run out of gloves down there. I'll have to open a new box, I think. Yes, I'll have to open a new box. Those are medium. I have large. No, I'll stick with the medium, I think, so just bear with me one moment. So these are very durable gloves, as you can see. Very, very good. They don't rip very easily, not like the real thin ones that you can get. These are really good. Really, really good. These are the medium ones, so I'm hoping that they fit. I'm also hoping that they have 5 finger holds, because that would be good, would it? So, they seem to fit perfectly well. So it's a good choice going for the medium. Okay. It's always a struggle putting gloves on, isn't it? If you find yourself putting gloves on to do the dishes, or even gardening gloves, or even driving gloves, it's always tricky putting them on. There we go. Okay. So, now I have to put on this hat as well. It's not very designer, but it's part of the job. Right then, so I'm just going to have a little feel around your temples and around your head, okay? So please be patient. patient. I'm not going to hurt you in any way. It's just going to check for any swelling or any abnormalities, okay? Great, so I'm just going to come out here and just have a little feel. Okay. I'm just going to apply a little bit of pressure on your temples, okay? If you have any pain or anything else, just let me know, okay? So, can you feel that? Okay, yes. Any pain at all? No. How about this side? Any pain? No. And around the back of the head? Any pain at all? Around the side? Any pain at all? And this side? Any pain? Okay. So there doesn't look to be any swelling, which is a great thing, obviously. And no abnormalities that I can currently see or feel. Okay. So what I'm going to do now is I'm going to just have a little look at your eyes, and I'm going to be doing that by shining a light. Now it's a very, very common procedure. What I'm doing is simply using just a very simple pen, light, however you want to call it. As you can see on the side, it has a number of circles. Now, these circles represent, in millimeters, the size of your pupil. You have ranging from very tiny 2 millimeter, which is normally the kind of size if you have bright light shining into them. And you have all the way up to 9 millimeters, 9 millimeters, which is if you have a very low light. And the eye opens right up to let in as much light as possible. Okay? So what I'm going to do is to shine this into your eye, left and right, and just make sure that it's dilating properly and fast enough. Okay? Great. So what I want you to do first is just cover your left eye. And I'm going to have a little look in your right eye first, okay? So just cover your left eye now. Okay, so I'm just going to shine this light into your right eye. Okay, just going to get a little closer look, okay? I know it's very bright, I'm sorry. Okay. So if you would like to just cover your right eye now, and I'm going to have a little look at your left eye, okay? Great. So just cover your right eye. I'm just going to shine a light again. Okay. And just going to have one more. Does that one seem brighter to you at all? It does. Okay, I'm just going to have another little look, okay? Okay, you can remove your hand from your face now. Okay, so what I can make out is your left eye is not really diluting fast enough. So I'm just going to have a little, I'm just touching around your eye at the moment, okay? If you feel any pain at all, just let me know. Have you had any trouble with your eyes before? No, okay. Do you have anything like glaucoma in the family? No, okay. And have you had regular checkups with your opticians? No, okay. Well, I will advise booking an appointment with your opticians. There's nothing serious at all, but it's always best to get checked out. Normally go and see your opticians every couple of years, or sometimes it's every year, depends on each circumstance, okay? So I'll get back to your eye a little bit later on. What I want to do now is just check your general health, make sure that you're okay, make sure there's nothing else wrong with you, peace of mind and all that, okay? So I'm just going to start off by checking your heart rate. So I'm just going to place this on your chest and just make sure you're okay. So I'm just going to tap out every time I hear your heart. Okay. So your heartbeat is normal, which is great. Okay, so just going to write a few notes, okay? Just to basically say that I've checked your eye and your heartbeat. So I am going to recommend an appointment ASAP with your optician. Do you have details of an optician? Are you registered with one? You are, okay. I'm just going to ask you a few questions about that, okay? Right, 1 moment. So what opticians have you registered at? Oh, okay. And that's the one just a mile down the road? Yeah, I know that one very well. Okay. Yeah, that's fine. I don't think there's anything wrong, but the eye is not dilating as much as it should be, so it's a little bit concerning, but nothing to worry about. So I can't stress that enough. It's really nothing to worry about, but it's always good to get it checked out, okay? It could be something just simple like you might need glasses or prescription contact lenses, that's all. Have you worn glasses before? You have, okay. How long ago was that? About 5 years ago. Right. Yeah. Okay. So what I'm going to do, with your permission of course, is book you an appointment with your optician. Is that okay? Yeah. It will be a free consultation. No, it will just be a completely eye test, but because I'm referring you, it will be completely free, okay? Yeah. So, if I can book you in next Tuesday, is that okay for you? Yeah. I can get you in at 4 o'clock. 4 o'clock, okay? Yeah. Okay. What I shall do is I'll give them a ring and just make sure that they can confirm your booking. Okay. I'll just go and grab the phone. Hi there, it's Dr. Smith. I have a patient in that I would like to refer to you as soon as possible, if that's okay. Next Tuesday at 4 p.m. Is that okay? It is. Yep. Okay. Thank you. Bye-bye. Okay. That's all booked in for you. So you'll see them at 4 p.m. Next Tuesday. Okay. I'll just... If I give you that, it's just to confirm your booking so you don't forget, okay? There you go. Thank you. Right. So I'm just going to ask you a couple more questions regarding the headaches that you've been having. Okay. Do you drink a lot of caffeine drinks? So drinks such as coffee and tea and that kind of thing? Yeah. Okay. And what is that? Is that tea or coffee or both or anything else? Coffee mainly, okay. And how often would you say you drink coffee? Okay. So you normally have about 7 to 8 a day, 7 to 10, okay. It's quite a lot of coffee. You're cutting down, okay. So when was the last time you drank a coffee? A couple of days ago, okay. And you haven't had one since? What about tea? Have you had a cup of tea? No. Okay. And have your headaches been getting worse since then? Yeah. Okay. Well, what I'm going to suggest is number one, have another coffee. The problem is, when you drink coffee, it's filled with caffeine, and what caffeine does, it draws blood away from the brain. Now, what your body does, it sends more blood to the brain to compensate. So if you drink a lot of coffee during the day, the body is pumping more blood to the brain. So if you just come straight off it and stop drinking coffee completely, then your body is still pumping extra blood to the brain because it's thinking that you're drinking coffee. And obviously the caffeine in the coffee draws the blood away. So what happens is the body is pumping too much blood to the brain, and that can cause the brain to swell, and that pushes against your skull membrane, thus giving you headaches. So when you feel that kind of heartbeat sensation, that's what's causing it, I believe. It's the same if Or the opposite, if you go out drinking alcohol, and the next day you wake up with a hangover, you've got a really bad headache, that tends to be because alcohol is not good for you, and your body just wants to get rid of it all. Okay, so most of the contents of alcohol is released through urination, and you can urinate 4 pints to every 1 pint you drink, which is quite remarkable. So with that, your brain has a lot less water and shrinks, thus pulling down on your membrane, on the skull membrane, which can give you headaches again. So it's always best to drink lots and lots of water before you go to bed after you've had a drink, and that can reduce headache in the morning. Yeah, well, being a biologist and knowing lots of things, as part of being a doctor, I learn a lot about biology, and obviously knowing how the body works and little tips and tricks like that, very, very useful. That's why I never get a hangover. Partly because I don't drink a lot neither, but, you know. Okay. So what I'm going to say is I'm going to advise you to drink coffee. Now, if you want to reduce your intake, gradually come off coffee. So maybe have 1 or 2 cups less a day. It's always best to allow your body to adjust to a change. It's not going to happen overnight, so you have to gradually come off, okay? Right. So, as a registered dentist as well, I can have a look at your teeth today if you would like me to. Yeah. It's just going to be a very simple check. There's no drilling, there's nothing like that, so there's nothing to worry about, okay? Yeah? Okay. I am going to have to wear yet another piece of clothing. It's a good job I'm not a designer. Okay, so I just have a couple of little tools, such as a mirror. Okay, so if you'd just like to open your mouth for me real quickly, and I'll just have a little look. Okay. Okay. Your teeth look really healthy. Yep, they do. That's fine. Okay, no, that's it. That's it. All done. Right. Okay. So I'm just going to write you a prescription for some painkillers for your headaches. So just check your records, make sure you're not allergic to anything. You're not? Okay, well I just need to check anyway, because I don't want to be responsible for causing any harm. Okay, okay, that's fine. So I'm going to prescribe you some painkillers. Just find the prescription page. Okay, let me just... Yeah, okay, there it is. So, you can pick these up at your pharmacist? Anyone, yep. There'll be no charge at all. Okay. So if I give you that. Thank you. Okay. So that's all for today. Thank you very, very much for coming to see me. I have been Dr. Smith. I'm hoping you're happy. If you have any more problems at all, come and see me. If you continue getting headaches and they get worse, let me know. Make sure you go and see your opticians. Okay? Well, have a very, very pleasant day. And I'll see you next time. Bye-bye.